Hi, welcome to today's webinar. We're just about to get started. I just wanted to run through a few logistics on the webinar. If you have any issues hearing us or throughout the webinar, feel free to send me a message on the chat. You can send it to organizers. We'll also have the participants on mute because we have quite a few of you on today. But if you have questions or comments throughout the webinar or during the discussion, feel free to send through those comments on the chat, and we'll bring them up to the panelists. If you have any questions, feel free to send us a message, and we're just about to get started.
Okay, so hello everyone and welcome. My name is Jessica Lenz and I'm the Senior Program Manager for Protection and Interaction. We're excited to present to you today our second webinar and online discussion under the Interaction Results-Based Protection Program, Communicating with Communities, the Role of Information, and the Flow of Communication with Affected Populations to Achieve Protection Outcomes. This webinar and discussion has been co-organized and developed by Interaction and the CDAC network, which is the Communicating with Disaster Affected Communities. For those of you who are unfamiliar with Interaction, Interaction is an alliance organization based in Washington, D.C. and has over 180 plus NGOs as members. And the members work around the world addressing both development and humanitarian issues that affect the world's poor and most vulnerable populations. So as mentioned, this webinar is part of a series of online discussions under the Results-Based Protection Program. Recently, organizations that have been addressing protection issues in humanitarian situations, like gender-based violence or the recruitment of children into armed forces, have come under increased pressure to demonstrate whether or not their programs or response have actually produced a protective impact. Given the sensitive nature of protection and the difficulty in looking at prevalence of risk, protection actors have often found themselves measuring outputs or their activities, such as training police or the number of child-friendly spaces established, but we've had little evidence to show whether or not these activities have led to actual change in people's lives in terms of the reduced risks of violence, coercion, exploitation, and deprivation. So the Results-Based Protection Program was launched in 2012 to explore this further and to identify the key elements that support a more results-based approach to protection. So over the past 2 years, we've identified several key elements, one of which is that the affected population is the starting point for any and all interventions that are likely to contribute to protection outcomes. But what do we mean by starting point? How do we engage populations? How do we listen and how do we communicate? We know that the facilitation of information flow to and from affected populations can be a critical component of not only understanding but addressing the risks people experience during crisis. Information from an affected population obviously informs our assessments and analysis, and information can additionally enable affected populations to assess their own risk, consider their options, and take action to reduce the risks that they face. Very conscious and deliberate facilitation of information flow may be part of not only assessments and analysis, but may take on a central role in program design, implementation, monitoring, and evaluation. And that is what brings us here today. Through the panel of experts that we have brought together, we hope to explore the role of information and flow of communication better. The objectives of the webinar and the online discussion that will follow are, you should see these on your screen, capture the examples of good practice that demonstrate how information can be used as a tool to address protection issues, to better illustrate and articulate the necessary components of facilitating information flow to and from affected populations throughout the program cycle, to capture differences in approaches, lessons learned, and proven methodologies that enhance information and communication for protection outcomes, and finally to explore the challenges in information and communication flows and reflect on approaches used to overcome these challenges. So to get us started, and as I said before, CDAC is participating with us and who have organized and developed this webinar with us. We'd like to set the stage and allow Nicki Bailey, who's the Research and Learning Officer with CDAC, to kind of set the stage and letting us come together and understand what is communicating with communities and why is it relevant to protection. And in addition, Nicki, I'm wondering if you could also talk to us about how the information needs of affected populations are identified, assessed, and conveyed. So I'll let Nicki please start us off with this webinar.
Sure, thank you, Jessica. Can everyone hear me okay?
Yes.
Right, so sure, by way of introduction, as Jessica mentioned, I'd just like to introduce the CDAC network. So it's the Communicating with Disaster Affected Communities Network. It's a group of 23 organisations who've come together to do what it says on the tin, really, to try to improve communication with communities in humanitarian response. The network was started back in 2009. That was the first meeting of the network. And it was started as information was consistently identified as a gap in humanitarian response. For example, from the Asian tsunami in 2006, and the BBC policy briefing paper Left in the Dark from 2008 is a key text to read for any participants of the webinar who are interested. So the first meeting of the network was in 2009, although the discussion had obviously been going on before this. Members of the network include NGOs, media development organisations, UN agencies, ICRC, and a number of more technical service providers, some of which are from the private sector. Members came together from these different fields in recognition of the need to work together on these issues, with the realization that no one member would find it easy to meet challenges of communication alone, and that they needed to really come together and pool skills and expertise from these different fields of work. So I'm really pleased to see representatives of a number of our member organisations on the panel today, a number of them actually founding organisations, so from Internews, OCHA, Plan and Save the Children. And participants can find details of all the members on the CDAC network website as well. So what is communicating with communities? As I mentioned, it's really a field of work which aims to improve communication with communities affected by disaster. So there's really a focus on providing information which is useful for communities, not information or news about communities, so a focus on news you can use, to really term a phrase from CDAC Haiti. And also focusing on two-way communication with communities, so not only communicating to them, not messaging out, but really engaging in two-way dialogue. So it really aims at both effective communication between humanitarian responders, so that might be aid agencies or local governments, but also focusing on supporting connectivity between communities themselves. Communication with communities, or CWC, is based on the premise that people need information as much as they need water, food, medicine or shelter, and that was outlined clearly in the World Disaster Report back in 2006. People need information to know what's happening, where they can go for assistance, and how to avoid further risks themselves, but they also clearly need effective communication channels to be in constant conversation with humanitarian responders and make sure their needs are being met in the most suitable and effective way. Info as Aid, which many of you may have heard of, was a 2-year project led by the CDAC network members BBC Media Action and Internews. It was funded by the Department for International Development here in the UK. And they developed a very useful animation about the importance of information in disaster, and that's available on the front page of the CDAC network website if anyone wants to have a look at that. The network also takes into consideration new technology and the fact that we live in an increasingly networked world, which network members see as an opportunity for improved dialogue, effectiveness and accountability within humanitarian response, but obviously doesn't come without its challenges. So why is CWC and the CDAC network relevant to protection? So it's a topic which very frequently comes up when we talk about communication with communities, both in terms of how communication with communities can support protection efforts, as well as some of the challenges that are raised. Jessica mentioned earlier some of the ways CWC can support protection, which are often cited. So in terms of ensuring people have information about how to access services and protect themselves and avoid further risks themselves. Also in terms of having safe channels through which to raise protection issues around reporting abuse of power, and a platform for information and discussion around sensitive issues as well. From a psychiatry point of view, 5 intervention principles have been developed to guide programming following natural disasters and mass violence. So these 5 principles are essentially what all humanitarian programs should be looking to support. If we look at these 5 principles, we can see how CWC can play a part in supporting in achieving each of them. I'll just run through them very quickly. So the first one is promoting a sense of safety, so acknowledging the importance of accurate information to help dispel rumours and horror stories, and also ensuring that people have information about survival of their loved ones and they are able to connect and find out, really connect with each other. The second is promoting calming. The third is promoting a sense of self and collective efficacy. So this focuses on the importance of people feeling they have the skills to solve problems themselves, and also on communities conceptualizing and implementing activities for themselves. The fourth is around promoting connectedness, so supporting existing social structures and communication channels to ensure people can connect in ways that they have previously in order to share knowledge and offer social support. And the fifth one is promoting hope, where we do see examples of local media being able to support here as well. So that's some of the ways that CWC we think is aligned with protection efforts. Some of the challenges which are sometimes raised when we talk about CWC in terms of protection are concerns about raising expectations of communities by giving information, or even sometimes by opening communication channels, danger of providing false or unverified information and the impacts that that might have, and also data protection issues, so obviously around sensitive issues, particularly when we're talking about using new technologies such as social media. So for the CDAC network, we're really excited to co-organise this panel, as it's a topic which comes up frequently, and although we have discussions and thoughts, we certainly don't yet have any clear answers or guidelines on how CWC can really support protection efforts. We're really excited to bring together protection and communication with communities professionals in this discussion, and I'm particularly looking forward to hearing from panelists, especially colleagues who are grappling with these issues on the field, and really get this conversation started. I just wanted to mention quickly before I pass over to the next panelist, in terms of information needs, and perhaps we'll come back to this in the online discussion later, the CDAC network has developed some guidance on assessing information needs of communities, and also looking at appropriate channels of communication which humanitarian agencies and others might be able to use to communicate with communities. In terms of the important things to think about, obviously, is that communities are not homogenous, so it's important to think about age, gender, different groups within populations when doing these assessments, and tailoring any kind of communications accordingly. I'm sure some of the panelists will touch on this later, and I can certainly come back to it later in the discussion. Thank you, and welcome to the discussion.
Thanks, Nicki. I think you gave a really good foundation for what communicating with communities is, and really how it is relevant to protection. And I hope that through the rest of the panelists as well, they'll go deeper into allowing us to explore this a little bit further. One of the key things that we think about, especially in protection, when we start talking and engaging with affected populations, is the importance of listening to populations. And so I'd like to invite Dayna Brown, who's the director of the listening program, to talk to us a little bit about how do we listen to the needs of different people without listening to what we want to hear or setting our own agendas. So Dayna, welcome, and please share with us your experience with this.
Thanks. Can you hear me okay?
Yeah.
Okay, great. Well, thanks for the invitation. And just by way of background, a lot of this is, a lot of what I'm going to share is coming out of our work in listening to over 6,000 people in over 20 countries over several years about their experiences with aid efforts more broadly. So not protection or any particular sector, and not only humanitarian, but many of the places where we were listening to people that had experienced humanitarian assistance in crises at some point in time. And then a lot of follow-on work that we've done with ALNAP and with a lot of CDAC members and others in terms of looking at the effectiveness of feedback mechanisms, which are ways that organizations explicitly are trying to listen to to communities and their concerns, as well as work we've done with ALNAP looking at the just overall how agencies are engaging with the crisis-affected people, and CWC is one of the kind of emerging, areas of practice that we looked at in the report that we put out last year. So I just wanted to say, I think we can't really talk about communicating with communities without looking at communications within communities, which I think was something that Nicki was alluding to. Who is able to speak, who isn't, who's excluded, whose voices are really included, who's doing the listening, and who really has power and influence. I've been in I've been in some of the community centers, the child-friendly spaces, a lot of the places where we hope that people will use feedback, where there may be feedback boxes, where there are hotlines and other types of sort of feedback and complaints and response mechanisms, and other types of communication tools that, or agencies are increasingly using to try to improve how we communicate with communities. But to understand if these mechanisms and tools and approaches are really effective, we have to look at the processes that are used in these places to facilitate communication, and to see whether protection concerns are really able to be addressed through those. So just 4 things that we kind of need to look at are, one is do people feel safe in these spaces and in using the channels that are provided? Who has access to them, and who are the most vulnerable and at risk, and do they actually have access? And it's important to look at sort of who are the gatekeepers and who may limit access or the flow of information, who may prevent certain people and certain voices from being heard within communities, and those may be the very ones that those who are focused on protection most need to hear. A second is looking at whether all voices are respected and heard, and whether the most vulnerable are really able to speak up, and whether the issues that they may bring up are really respected and prioritized by leaders in their communities who may have a very different view on what needs to be addressed. A third aspect is whether people feel that their concerns are being addressed by those who can. Are the complaints being responded to in a timely and appropriate way? And do they see changes in the programs and the approaches, the assistance, and ultimately in their lives? When they give feedback, when they share information, do they see something happening? Do they see a change that really makes a difference to them? And if they don't, I think one of the things that we've seen is that people lose trust in these places, in the mechanisms, in the processes, in the people, and ultimately sometimes in the organizations who are meant to really support them. And no matter what we do, if that trust has been broken, it's really hard to gain back. So a fourth issue is also to look at whether people have a role in decision making. When organizations get information, how do they use it? Do they share that information back with people? We heard people in every place asking, what happens with all this information? We've been involved in assessments and evaluations. We've talked to lots of people, but we never know what happens with that information. No one ever comes back to us and tells us how it was used. Sometimes we see a program or a project evolve, and sometimes we don't. And that, I think, is another thing that's contributed to a lot of sort of disappointment and often distrust of a lot of humanitarian organizations. We don't close that loop. We also need to look at whether organizations are involving people in a really meaningful way in the analysis of the problems and the issues, and in coming up with the solutions. It's not just about asking questions, but too often people see sort of prepackaged programming that assumes what's needed, that we've listened, but at the same time we come in with pretty much the same types of solutions that we've used in lots of places. So it's that tailoring that Nicki was talking about in terms of communication channels, but we need to be doing that much more in the programming. And lastly, do organizations engage people in really meaningful ways in the implementation and in the monitoring and in the evaluation of programs and the approaches? And I think it's really important as you're looking at results-based protection is how are those most affected and those who are most in need of protection involved in determining what good outcomes and impacts look like from the beginning. So it's really important to test our assumptions about what and how we're doing to address protection and other concerns that people have. A second key thing that we found, and this was really as much throughout the listening process and in subsequent work that we've done, is that we have to look at how well people listen and communicate with one another, both within and between communities, between families, between groups within communities or camps if they're in a camp setting. And we also have to look very carefully at whether the staff of our organizations and the government authorities are open, accessible, and approachable to dialogue. Do they take the time to listen? And the concerns about risks, protection needs, and so on can come up in any kind of conversation if people feel safe. And they need to be able to trust the people that they're talking to and to trust that they'll be heard, whether it's someone that actually focuses on protection or not. So I think one of the things that's really important is that all staff really need to have good listening skills and to be able to listen to what people are worried about and not just what they're concerned about, such as, a lot of times staff are focused on shelter or water or health. And one of the casualties, I think, of this sort of increasing specialization in the humanitarian sector is that people listen often with very particular lenses or agendas and biases. And they often have, we have very predetermined questions and areas of inquiry. And we miss out too often on hearing about other issues which are just, if not more important, to those that we're trying to assist. And we found in our listening exercises and subsequent work with a lot of agencies that a lot of humanitarian staff are actually are not very comfortable sometimes with very open conversations about broader issues than the sector they work in or what they're focused on. And they're very used to questionnaires, and they're not very used to open-ended sort of listening processes that enable people to bring up the concerns and ideas and risks that they may be facing. So good listening and communication skills are really needed to build trust and to enable people to talk about sensitive issues. And this is certainly not anything new to those of you who work on protection, on PSA, on protection from sexual exploitation and abuse. You have to have safe and trustworthy channels. But in all of this, in all of our work on communication, relationships are really key. So we have to focus not just on the programs and the tools, but just as importantly on the processes and the people to ensure good impacts and outcomes. So I'll stop there, and maybe we can talk a bit more about some of the things in the follow-up.
Thank you, Dayna. That was really useful, and especially your points around engaging and listening to populations, especially looking when you're doing a protection analysis. So I felt that was quite relevant. I'm wondering, before we move on to our next panelist, if you could talk to us a little bit more then in terms of what do we mean in terms of accountability to affected populations as it relates to addressing protection concerns?
Sure. As I think I was alluding to, listening and accountability is really everybody's responsibility, no matter whether you focus on protection, shelter, health, water, communications, or other sectors. And I think it's one of the reasons I think we have not made as much progress so far, is that we've tended to kind of, like with everything, we've projectized it and we've given it to certain staff and not made it something that is seen as everybody's responsibility. And I think the first aspect of being accountable is listening. We have to listen to people and to hear what their issues are, what they're concerned about, what they're afraid of, and to be able to know whether they need protection and support. And often what we found is that protection and a lot of times other issues come up and are heard from people who may be out doing a shelter assessment or some kind of assessment of some other, or having a meeting about something. But we don't always have the processes or the systems to capture these issues, and so often they're lost and they're not responded to, and therefore we're not being accountable to them. People feel if they've raised an issue that they want to know that it's been heard and that somebody's hearing it, somebody's going to address it. And when that doesn't happen, we really don't have accountability. And so, when we have to really close this loop and ensure that that those who are able to address issues, whether it's the government or local organizations or other humanitarian actors, get the information about concerns and follow up and engage people in looking at and understanding that and in developing solutions, and maybe just in providing them with more information. A lot of what we heard was often that people felt like they did lack that information and a response back to the concerns that they've heard. While a lot of organizations, I think, have made tremendous progress in establishing complaints and response and other kinds of feedback mechanisms, we still have a long ways to go on the collective level and at the interagency level, and sharing information across sectors, so that if you're someone who works on shelter but you hear things and you're seeing things that actually are increasing people's risks, that there's a linkage and to those who are working on protection and sharing information and figuring out how to address that, and making sure that if things can't be addressed, that information is given back to people, and sort of it really is about closing that loop. And that accountability too often is seen as just participation and ensuring people have a voice, but it really is about ensuring that people have choice as well, and that their voices are really truly heard and responded to in a meaningful way.
Thank you, Dayna. That was really helpful. I'd like to have us turn now a little bit to the field, in a sense, to see how some of this actually plays out practically. And we have Stijn Albers, who's with Internews, who's the Ebola project coordinator. And I'm wondering, Stijn, if you could talk to us about how is a safe environment then for dialogue with affected populations established and maintained? And given that you have been working with Internews, and therefore a lot with the media, how can local media and program staff from humanitarian agencies work together towards a common goal and respect each other's expertise?
Yes, thank you very much. I hope everybody can hear me well. Well, let me point out a few issues that I think that everybody will immediately think about when you mention local media and when you set up those channels, because so far it might be a little bit abstract, but very concretely, Internews is not platform specific. Lots of people will think that we always want to work with local media, which it's true, but also that we work a lot with radio, which is also true, but it's not exclusive radio, and we can also work with other organizations to see how they can set up channels, which obviously need to be safe. I've been thinking a little bit about this crossover between protection and CWC, communication with communities, and setting up those safe environment, which obviously has issues. But I think to start with, working with local media, for me, is a given, because they will talk about those issues. They will cover the humanitarian response. They will bring out some of the stories that maybe need a little bit more care when you bring them outside to a bigger audience. So I think it's our duty to work with them, to coach them, to make sure that when they get information which is sensitive, that they know how to work with it. And that's what we try to do. As much as a sort of maybe challenge, there's a huge benefit in working with local media, because very often, and almost by default, they know the local context very well. And yes, there might be some media outlets that are not helping, but there are definitely lots of local media practitioners who are trusted and who actually hear a lot of stories. And I think what we try to do is to sort of make them understand their role, not just as exposing and bringing stories outside, but as an intermediate between what is actually going on among the community, including protection issues, and what the humanitarians might be able to do about it and can provide services. So that's sort of maybe a little bit the general context. Very concretely, I think what we try to do is to bring some issues that are very often, and maybe some of the protection officers that are following this might recognize this, are perceived as an outsider issue. I think about lots of gender issues that are considered maybe a sort of Western invention. Like what you can do, not just by going by case, which is something I think the protection field is very keen on, because there's a lot of issues around privacy, obviously, and to work with sensitive cases. There's a lot of care about not exposing those already vulnerable people, the survivors, to more abuse. But what we can do by including local media and by setting up channels is making it a community-owned story. Like if we get testimonials from the community about those issues that we've seen arise, well, it's harder to argue as a local government that this is an invention of those Western organizations. It's hard to argue against your own people. And I think that's something that I've seen when it comes to protection issues that we can do. I want to give a very concrete example, and this time from South Sudan, where I also worked. Like very typically, humanitarian organizations work with the local community through representatives. The community leaders, the women's council, the youth representatives. But each and every of those channels, as much as they are valid in their own right, they have a limited scope. And I think very concretely, I remember a conversation with the community leaders in Kodok, Upper Nile State, South Sudan, who said, we don't need separate latrines for women and men. We don't need that kind of nonsense. We've always done it somewhere around outside the village. We don't need those gender-specific latrines. And you look around the table, and all of these community representatives were older men. What we did as Internews and what we did as a CWC intervention was we started collecting stories. We started interviewing 14-year-old girls. And we brought that to the table as to support the intervention, because those 14-year-old girls, they said, we don't want to go to the latrines, especially not after it gets dark, because we get arrested by the boys. And you see where you have it in conversation from your own mandate, from a very valid point of view, I would say, it gets harder to argue against it if your own 14-year-old girls, nieces, daughters are actually confirming the need for these kind of interventions. It's just an example of how, by using local media, by using reporters to bring out stories, how you can actually make sure that it's more community-driven and supported by the community, I would say. There's another, so that's something that I wanted to point out, that, yeah, humanitarians and the protection officers, privacy, which is a very valid point when it comes to case-to-case issues, you can actually still work with local media and with other channels to bring it to another level and to start a conversation, a wider conversation about the issues among the community, I would say. I agree with the previous panelists that listening is very important. I also would like to push it a little bit further. There's no point in listening and collecting if you're not doing something with it. And I think there is a slide that I've drafted to explain this to, well, some of my humanitarian partners that I worked with in South Sudan. I think if you look at CWC, you can have different levels of communication with communities, and you can go from like a one-way informing to listening to discussing, which is already two-way, but very often through representatives, to actually make sure that you have a multiple amount of channels and paying attention, as the previous panelist rightfully pointed out, to make sure that you understand who's talking, who's listening, what the power relations are. You make sure that you have as many channels as you can set up that are as much as possible inclusive and allow for a continuous feedback mechanism. And then it only really matters, and that's why there's a fifth level, when that information is also used to change, adapt the humanitarian response, I would say. So that's a little bit my overall story. Like, yes, let's listen, let's discuss, let's engage, but even that level of engagement, like, it's nice to know what people want and what the concerns are and what the questions are, but let's also look into how can we actually open up our humanitarian response for participation, that it also shapes our humanitarian response. And I think that's, for me, a very important element when we talk about all these communication channels. It's not just to talk and not even just to listen. It's really to make sure that what we do has an impact, and in that we are, as an organization, as in multiple organizations, are accountable. I think I'm going to leave it here for now. Obviously, there's a lot more. but I'm sure we'll get to that later.
Great. Thanks so much, Stijn. I'm wondering also if you could talk a little bit more on your recent deployment to South Sudan when you were the technical advisor to the CCM cluster. Can you give us some examples of protection issues that arose in camp management and how establishing CWC mechanisms address some of these protection concerns?
Yeah, I already gave an example in my previous presentation. Like the harassment of girls was an ongoing thing. But more importantly, or not more importantly, that was, I think, an important example. But I think one of the things that I learned in South Sudan is the camp management in the CCM cluster. They do engage with the community through, for instance, the community leaders meetings that I think most of us know. They have feedback mechanisms, but one of the things that I, as an advisor, asked them to change was like the feedback mechanisms are very, I would say, heavy in the sense that they're set up from a legal perspective with a lot of concerns around protection issues and around privacy and around all of the valid concerns that, of course, are living among the protection cluster. But as a result, they get very formal and they get very legalistic, if that would be a proper English word for it. Whereas what I advocated for was to set up community meeting spaces, not just for people to meet, but that as a premises to allow a space where not only the local community can meet each other, but of course where they also can meet the humanitarians. And I think one of the lessons that I learned in South Sudan was by approaching it directly, as in the protection cluster would set up a protection desk, and the child protection cluster would do something for children, and camp management would set up a desk as well to answer questions around camp management, that those channels were, as it seemed, like hardly used and only used in very extreme cases. And I think I would advocate for a more indirect approach. You create an environment like a community tent where you can actually drink tea and where people can sit and talk about anything, which allows in itself to have like smaller stories, little issues, not immediately the very, very heavy cases to come up. We learned a lot through those sessions. We literally provided tea and we sat around the teapot. Things came up that weren't coming up that when you would make it a very formal procedure. And I think that probably relates also to the listening project. You allow people to talk about anything, and you will actually capture, in my experience, more than when you want to talk about exactly what it is your mandate is telling you to tackle.
Thank you, Stijn. That was really helpful. I'd like us to now turn to particularly protection issues. And we have Jenny McAvoy here, who's the Director of Protection at Interaction. And I'm wondering, Jenny, can you talk to us about the ethical considerations and protection standards we must take into account when communicating with communities?
Yeah, hi everyone, and thanks very much for the opportunity to join you today. So I wanted to start with, in fact, an ICRC-led process to identify and establish some professional standards for protection work. The standards identification and sort of the process of drafting these standards involved humanitarian and human rights organizations, both NGO and UN. And the idea was not to replace other more specific standards, but to establish a common framework for overarching professional standards. And an update was published in 2013. And I think a link should have appeared in your chat box where if you just click on it, you should be able to access the standards.
So the idea behind the standards is essentially to, in the first instance, it establishes overarching principles and covers a number of different areas related to protection, managing protection strategies, outlining the protection architecture, ensuring a knowledge of the legal basis for protection, promoting complementarity between actors, ensuring professional competencies within one's own organization, and so on. So many of these topics should help to inform and support a process of facilitating information flow to and from affected populations. And one topic that is covered in some depth, in fact, relates to managing sensitive information. And this is where obviously a huge number of ethical considerations come into play. If you're interested, you can turn to page 78 of the standards and see this section. There's a long list of different considerations there, but I wanted to highlight just a few. One does relate to the capacity, skills, and professional knowledge and ability to manage information and to manage a dialogue with the affected population. So Stian's description just now I thought was really effective and interesting. And indeed, what would we expect of, say, the CCCM cluster in terms of managing a dialogue with an affected population that allows them to freely express themselves and allows you to understand the situation that they're facing, taking responsibility for the information they provide, and so on. Second, and perhaps this goes without saying, but certainly avoiding negative consequences for an affected population arising from the very act of collecting information, of course, is an important ethical consideration. Perhaps the most fundamental notion that I think we really need to take into account, understand the full dimensions of, and sort of build into our practices and ways of working is the idea of informed consent by individuals, recognizing that it's not our information and not for us to decide what is done with data when we are collecting information from an affected population. But it is for individuals to decide for themselves what information they wish to share, how they wish to share it, and it's our obligation to explain clearly how our information will be collected, how it will be used, how their confidentiality will be respected and safeguarded, and so on. In particular, I wanted to stress that any use of information beyond its originally intended purpose requires further informed consent. So in fact, we can conceive of the idea of informed consent not as a one-off exercise, but indeed as underpinning an ongoing dialogue with an affected population about their situation, about how information will be used to address the issues they face, and so on. And this very problem of multiple uses of data and the importance of ongoing informed consent arises in numerous types of situations that humanitarians deal with regularly. One example is data related to gender-based violence. Such data may be originally collected to design and establish services for advisors, for survivors, but quite often, what emerges subsequently is a desire to make use of data for criminal investigation and prosecution. And humanitarian actors are quite often under pressure to surrender data, but of course cannot do so unless there is further informed consent on the part of the affected individuals. So how do we manage these processes, and what sort of standards should help us to navigate and negotiate under those circumstances? Another very common example is we're often under pressure to surrender data to host governments or parties to conflict. And again, the clarity on our part of the standards that are being applied, that apply to those questions, should help us to negotiate and to resist pressure and identify what kind of data sharing is appropriate. Related to this, I really wanted to emphasize that the ethical considerations are very tied up with the other question that we're addressing today, which is what is the purpose? What is the desired impact of the process of facilitating information flow? So clarity of intent, clarity of purpose is essential in that it governs the design of the flow of information. It allows us to establish clearly what is the objective of the exercise, what is the desired outcome, and more specifically, what risk is it that we seek to reduce, and what role is information indeed expected to play in bringing down a certain level of risk that a population is facing. Thanks, Jenny. I'm wondering if you could talk to us then specifically on that point. How does a population's access then to information or lack thereof affect their exposure to vulnerability to threats? And how does meeting a population's information needs enhance their capacity to act in order to reduce their vulnerability and exposure to threats?
So I think the other panelists have described to a degree or have alluded to it. I mean, the lack of information is incredibly disempowering. You know, it means an inability to make one's own decisions, to be an active agent in navigating one's environment. It diminishes, you know, the possibility of collaborating with your own community to solve problems, to negotiate with other actors about your situation, to take practical measures to reduce your exposure to violence and so on. To be uninformed means to be vulnerable to rumor, to sensationalist propaganda, and to exploitation. And particularly if a population is displaced, you know, the community may be dispersed. You may be experiencing a loss of access to your usual means of information, and you know that will undermine you know the decision-making structures available in your community. So conversely, information can be incredibly empowering. An informed population can be the most effective agents to devise and broker their own solutions to pressing problems. And I guess I wonder, as a humanitarian community, how often, you know, we think that we must shoulder that responsibility ourselves rather than working with the community to enable them to be the brokers of their own solutions. So greater access can enable an affected community's ability to assess their own threat environment and decide on appropriate measures for themselves. For example, whether to avoid or to confront a threat, whether to approach parties to conflict about changing their behavior, about which service providers to approach about their issues, and so on. So for example, if we look at the standards associated with voluntary population movements and durable solutions, they emphasize free and informed decisions as fundamental to the notion of voluntariness and fundamental to the durability of solutions to displacement. Conversely, again, an uninformed population is vulnerable to coercion. So the very the very act of enhancing access to information helps to reduce vulnerability to coercion, while simultaneously enabling a population to come up with its own solutions. However, sometimes I think we do see humanitarian actors channeling very general information to an affected population. And this may be useful, you know, and any information is better than none, but if it's not designed as part of a very deliberate effort to address people's risk factors,
It may be a missed opportunity and not responsive to people's urgent needs, and it won't have a protective impact. It may be good, it may be useful, but will it actually be protective in the sense of reducing risk or reducing exposure to the most urgent threats? And in fact, in a situation of armed conflict or in natural disaster, when lives and the lives of your family, your livelihoods, etc., are at stake, where events are very fast-moving and the environment is fluid, information needs become very specific and become prioritized. So once again, clarity of intent on our part is exceptionally important, governing the content and the means of information flow. And this should have an effect on our approach to assessment, establishing a baseline, understanding what a community's information needs are, responding accordingly, tracking whether or not that has an effect on the risk that they're exposed to, and so on. So for example, some very important work has been done in the DRC to support community-level preparedness in the face of episodic violence over many, many years. And right now, in fact, the MONUSCO Force Intervention Brigade is preparing a major offensive against the FDLR. So as humanitarian actors, what is our obligation to ensure that populations in the affected area are informed and continue to receive information during these military operations, during these hostilities? This gives rise to additional ethical considerations, including the accuracy of information and being upfront about what we do and do not know. I can't emphasize enough that in these contexts, it's really essential to tailor and design processes of information flow against the prioritized risks that a community faces. And that means breaking down the risk factors in a very context-specific way and targeting information campaigns to reduce those risks.
Thank you, Jenny. This was very valuable, especially understanding the protection standards that we all need to be aware of. I'd like to take us now to Katie Drew, who's the Humanitarian Evidence Effectiveness and Accountability Advisor of Save the Children. Katie, I'm wondering if you can give, given your experience with Save the Children, what are some ways that enhanced access to information has enabled affected populations to take action on the risks that they face? And what kind of support might be needed to enable them to take these actions?
Sure. Well, thank you very much for inviting me, and I hope everyone can hear me. One of the benefits of going towards the end of the panel is that I get to draw on what everyone else has already said. So that's a great opportunity for me as well. So I just wanted to maybe sort of frame the conversation around two key areas and then show some examples from Save the Children's work in the DRC and also in Myanmar. So to begin with, I think it was important to draw on something that Nicki highlighted at the beginning, in the fact that people's communication habits aren't homogenous, and so we need to take into account, you know, children themselves have their own specific communication and information needs, and that's not homogenous amongst all children. Obviously that's broken down on a gender-specific and age-specific basis, and I think it's absolutely crucial that we have an understanding of the information and communication needs of children from the children themselves. And one of the examples I'd like to sort of highlight is an example there was a joint initiative with Save the Children and a number of other agencies, including PLAN in the Philippines, in which they conducted a children's mirror. That's a multi-sector integrated rapid needs assessment. They conducted one with children to look at the specific needs that the response needed to act upon based from children themselves, and that was seen to be sort of a key step that was taken in that response to start thinking about how do we shape our activities and our actions to really meet the needs of children themselves. Very often they are a voice that tend to be, as Dayna pointed out, there are certain groups within a society that are marginalized or maybe not listened to, and very often you feel that children are falling off the agenda, so it's important to listen to their needs and make sure that the response is designed in such a way, and therefore the channels of communication that you use to respond to children, listen to children, have to be adapted appropriately. And another thing that I would say, or the second point I really wanted to highlight, is that there's an absolute crucial benefit in building on local capacities and working with existing local community networks, working with local partners to make sure that we're really capitalizing on some of the great work that they've already been doing, sort of the communication networks that they already have, the social networks that are already there. And very often we can use those networks to very effectively run a protection response, a child protection response, and I'm going to use this one to sort of start drawing on some of the experience that we've got from the DRC, where we established child-friendly spaces, and we worked with children and local partners to map out who would be the best people to respond in an emergency, or to act as a referral mechanism, as a network to communicate amongst themselves and to identify possible service providers for a child who may be needed to be placed in a school or placed with a foster family for a short amount of time. And if we don't work with those local networks, we very often face the misfortune of alienating local people, disenfranchising children, and missing out on a real key sort of a resource that can be marginalized in a response. So they're my sort of two key areas that I would say. Definitely listen to children, listen to their needs and their communication needs, and build on local existing communication networks, and that can be local media, local civil societies, and local sort of informal networks that exist amongst women's groups that have already been established by pre-existing work, for example. I didn't know whether you've got the slide there that you can flash up from the DRC. I'm not sure whether you received it. This is a project that was designed in, it was funded by UNICEF and UNHCR, and it was a Save the Children project that we were working on in Goma in eastern DRC. It's a couple of years old now, but this is on the side of a health center in the DRC. We worked with local youth and a local painter, he's quite well known in the area, to design a mural basically looking at messaging around SGBV and adolescent and sexual reproductive health. And we worked a lot with the children themselves to identify what kind of messages could we display publicly and safely, what kind of images would they want to display publicly, and it's all around sort of linking this this health center to a referral mechanism, looking at, you know, people who are referred to services, how do we make it a friendly and appropriate place for adolescents to come to, how do we get the message out that these services exist within the community, how to start opening up that dialogue so it's something that is spoken about safely within that community. And I think it was really important to work with the children or the adolescents themselves, and we were working with children from around sort of 16, 17 and 18, and the local artist himself was quite young, and we brought in another group of people to help with this, to really make sure that we were appropriately having these conversations as safely as possible. We spent a while before we started painting on the side of the health center, just having the discussion, having the dialogue inside the clinic itself to think about what could be safely done. And then I'll move on to the next slide if I can. that's inside one of the child-friendly spaces in Myanmar, and this is making sure that information sharing with children is done appropriately. It's using, you can see that there's lots of cartoons that were used. This is highlighting some of the activities that Save the Children was doing in the area, some of the activities that local partners were also doing, and it's basically to try and create a space where children can start asking questions and start demanding more information, maybe better services, highlighting some of the gaps in the service provision that was there. And I think that this is where I'd like to go back to something that Stein pointed out, the 5 stars. In order to react and make sure that our programming is either corrective or adaptive, so make sure that we're listening to this feedback, that we're able to react. We need to make sure that children's voices are listened to, not just by an agency, a single agency, but the combined response and amongst the community themselves. So that's all about raising children's sort of voice in the community, raising their profile and making sure that they have a space that they can be listened to. So it's not just working with children, but it's working with local leaders, local media, local community members to really start highlighting the importance of listening to children, the value that they have in their community and their ability to respond themselves. So, for example, a lot of work that we were doing in Myanmar in this sense was all around risk mapping. What risks did they identify in their community? That can be anything from natural disaster risks, risks related to environmental degradation, risks related to lack of access to school or healthcare, for example. But how do we make sure that they're listened to? And I think that that's going to be really, really key in order to make sure that they continue to be engaged in the response, and we don't have, as Dayna calls it, if people don't have a role or don't feel they have a role in decision making, ultimately we will lose their trust. So it takes a while to gain children's trust, and the last thing we want to do is give them a platform to voice their opinion and not be able to do anything with it. Then I just wanted to highlight just one final slide that we were looking at, and from a protection point of view, this is one where we were talking about informed consent. So this is something that we designed in the DRC, and the importance of making sure the children know and understand why data is being collected, why data is being used, and what for, and really making sure that you go through that process with them. It's not enough to explain. You have to make sure that they describe back how they think that their data is going to be used, and you make sure that that's done in a safe space, and that agreement, that informed, confidential and voluntary commitment is agreed upon by all members of a group or individually if it's done through a case management. And so this was a flower that we designed in the DRC to make sure that children could put an impression of their thumbprint in the flower once they've understood and once they'd had the introductory to how their data management was going to be used. And this was following a focus group discussion to make sure that it really was a safe space and children understood that the information they were providing was confidential and it was on a voluntary basis. So I just wanted to highlight that from a data protection perspective as well. I'm sure that there are lots of other questions and definitely more examples that we can draw upon on sort of certain specific contexts, but I just wanted to highlight those two. Thank you.
Thanks, Katie. These are really good examples, particularly the ones engaging partners and local groups. I'm wondering if you can talk then a little bit more about the particular challenges that you found that hinder information flow and communication strategies, and what you did to overcome some of these.
Sure. I think one of the challenges that I found was very often communication does happen, especially our partners are so embedded in the community, they really understand the needs of the community. Very often some of the issues that are maybe raised or some of the conversations that are had at field level, and they happen on a day-to-day basis, and that's great, that's very natural, that's exactly how communication and dialogue should be, that's how trust is built up. But maybe at field office or even at country office, we lose that picture because we don't have that information coming up to field office and head office level. So it's very hard for us to adapt our programming to improve, for example, our protection outcomes if that information isn't flowing up and we're not able to sort of take a global perspective on it. And so without wanting to hinder that dialogue and to try and make that dialogue too process heavy, how do we make sure that we have that internal information flow that makes us able to next time program slightly differently or take into account some of the factors that are being changed or tweaked in our programming on a daily basis, be it, you know, that actually we changed the hours that the child-friendly space was run by half an hour, but how do we make sure that we take that learning and we make sure that that's being institutionalized so that we don't make similar mistakes or we don't face similar challenges next time. And it's not wanting to make communication process heavy interaction, but making sure that we capture the learning. And I think that there's a lot that CWC can be doing over the next sort of 18 months in terms of capturing the learning, capturing the advantages, and making sure that we realize how effective communication is in achieving not just protection outcomes but outcomes across the entire response, and making sure we have a better understanding of that at global level. That would be my sort of key challenge and key ask to all practitioners for their help and assistance with.
Thanks, Katie. So our final panelist, Alexandra Sikot-Levesque from OCHA, although last, I think very important, I'm wondering, Alexandra, if you can talk to us a little bit more about the coordination aspects of communicating with communities. How can we be more coherent on the ground? So we tend to see agencies operate in silos. How can we break down some of those silos, particularly when dealing with sensitive protection issues? How do you coordinate and bridge those key stakeholders and sectors with different agendas and priorities? Certainly conceptually, what does this entail, but practically, how is it done?
Thanks so much. I'm going to definitely look at more practical examples, looking at what we did in the Philippines, particularly, where I think it's quite a successful example of CWC coordination, and as well looking specifically at Iraq, where we had a lot of challenges for different reasons. So I don't know if you have my slides actually, but if not, it's not a problem. But just to quickly give a background on what OCHA does in terms of CWC, we obviously advocate for CWC approaches and services as a central part of humanitarian response, but really as well within the humanitarian system as a whole and within all parts of the humanitarian program cycle, from needs assessments to evaluation. So we support CWC actors, of course, and coordinate CWC activities in some contexts. And the Philippines, where I'm going to just give a quick overview of what was done in the Philippines, kind of gives that example. So if I could have the first slide, if it's there. Oh, no, okay, didn't get the slides. Okay, I just got that message. Okay, no problem. So in the Philippines, obviously we had quite a regional capacity. Stuart Davies, who's actually a participant right now in the webinar, could probably talk about it more eloquently. But in short, we had a capacity regionally. We had experience in previous emergencies in the Philippines, so we were able to deploy right away staff after Typhoon Haiyan to coordinate a communications with communities working group. So of course the working group worked quite closely with the Interagency Accountability to Affected Populations Coordinator, who was also sent as part of the response, which was quite crucial, of course, to make sure that, you know, CWC and AAP doesn't work in silos but actually work very closely together, because there's obviously very many aspects of both thematics that overlap. And almost immediately, just by setting up this working group, we saw a lot of partners getting involved, and immediately improved communications and bridge information gaps in the work that responders were doing. And as a working group, we were kind of the go-to to share information with the different clusters. The working group coordinator designed and supported different messaging, provided technical support to different clusters as well, and we ensured the two-way communication flow between affected communities and the different clusters and partners. I think what was unique about the working group that we had, particularly in Tacloban, was that we included affected people, first responders as well, so local NGOs representatives were there. I think about 30% of people who were involved in the working group were affected people themselves. We established a strategy and an implementation plan for the whole of the humanitarian community when it came to communication in the community specifically. As I mentioned, we also provided, of course, technical support to different clusters, and probably most importantly, we conducted and helped gather information and communications needs assessments. And I think what was important about the working group is that there were so many mechanisms that were set up as part of Typhoon Haiyan when it came to getting feedback, for instance, from communities. For instance, we had formal mechanisms. We also had informal mechanisms. By formal mechanisms, I mean focus groups, community consultations, etc. By informal, I mean feedback from community leaders, drop-in visits to UN, NGO offices, etc. So it was very important for all of that to come back to the working group, and for the working group to advocate with clusters and members to ensure that that information was coming back to the working group so that we can then pass on the data and the information back to specific clusters that needed to have that information, or if it was especially a priority, to the inter-cluster coordination mechanism, or if necessary, even the humanitarian country team. And I think what was interesting that came through from the Philippines, especially in terms of protection in CWC, there was an operational peer review that was conducted last year of the whole of the humanitarian response after Typhoon Haiyan. And it was pointed out that the protection cluster had a very proactive role in helping international respondents to be more accountable. And because of the protection cluster's frequent field visits and focus group interviews, it helped to point out gaps in the response overall and issues with communities, and that they were able to channel that feedback to different clusters. So in a way, the protection cluster played a really key role with regard to accountability affected populations and communications with communities. And it was recommended that maybe this is something that should be replicated in other emergencies, where the protection cluster, because of their access and because of their mandate, should take a more proactive role in terms of communicating with communities. And so that was a very quick examples of, I think, of a successful response in terms of the coordination aspect. And I think, in a way, the Philippines had a very enabling environment. There were a variety of partners, partners who were working specifically on communication with communities or media development, such as Internews, for instance, and others, obviously, who were working more on specific protection issues. So we were able to really bring together at the same table all these partners. But again, this might not be the case in all emergencies. And I was just in Iraq in August, where that was definitely more of a challenge. We had a lot of actors present, but your traditional CWC or media development organizations were not present. And so there was, perhaps, if I can say, not as much coordination that was possible. It was more a role, OCHA had to have a role of advocacy initially, and then to ensure that we were still coordinating partners to make sure that we were trying to communicate to communities despite the access issues. So one of the things that OCHA did was we set up initially a very basic phone line to receive information from displaced people, and especially people who were in areas that we couldn't access. And so, for instance, we started getting calls of people who were displaced in August following fighting in the northern part of Iraq, who were stuck on Sinjar Mountain, and they were calling to ask for airdrops of water and food, but they were also asking for mobile phone chargers, which I thought was very interesting, and pointed out to the fact that in a conflict setting like this, mobile phones, it's a critical means for protection, for people to ensure that they had, were earlier we talked about communications within communities, and to make sure that people kept connected to their communication, to their own community networks, to their own social networks, so that they could evaluate if they could move, if places were safe, and to communicate with the outside of Sinjar Mountain as well. And so we realized, obviously, and through advocacy with the CDAC network at Sharra, that as part of the response, communication with communities should be a priority. And so we did deploy an interagency rapid consultation, a team that went in to look at what were exactly the information needs of communities and what should be done to ensure that we do have a coordinated response and that agencies and organizations don't work in silos. So, I mean, the first thing that was recommended as part of this consultation was that we should establish a communications with communities, mechanism within the cluster system so that we could share information within the cluster system. And one of the recommendations as well was an interagency call center that was actually brought forward by UNHCR and the Protections Cluster as a means for them to get access to communities and to get information on key protection concerns, and for as well for protection actors to be able to communicate critical information, life-saving information. So we decided that this call center should be interagency to ensure that all parties of the humanitarian response were involved and that they could share information more accurately between partners. So this is still in the midst of being established, and we're hoping that by February this year we'll have a call center operational, and that the information that will come in from the call center will be sent to different cluster members depending on the information being provided, and as well that OCHA will be able to participate in coordinating all that information that will be coming in through the call center. And so I think that's about it for now. That's just a quick, very overview of two very different emergencies. And I think in the Iraq situation, as I said, one of the challenges was that we didn't have as many partners who were focused on CWC. And initially we had to do a lot of advocacy. And once we did that advocacy, we together as a humanitarian community, we worked together to identify the different gaps and what were the best ways to address them as a community.
Thank you, Alexandra. And first I'd like to thank all the panelists. We're running a little bit short on time. We have about 10 more minutes left. And I'd just like to say that we've had such a rich discussion and really good and useful examples that we hope to be able to learn from as we think about protection and protection outcomes. But before we go, I'd like to open it up to our participants that are online that have been writing in some different questions so that our panelists can respond to some of those. Eileen, can you read some of the questions?
Yeah, we had a question stemming from Katie's example in the DRC where she talked about the importance of targeting information and conducting a campaign. One of the questions was about what concrete examples affected people themselves were engaged in identifying risk levels and expressing their information needs and things like that. Where exactly was the two-way component in that work?
Sorry, I was just unmuting myself. So was this in the DRC itself, or
yeah, stemming from,
was the question related to the DRC? Where was it?
Yeah, stemming from your example that you presented, if you could kind of delve more deeply into where the two-way component of engaging with that affected population was.
Sure. So we were working with another organization called APT-ART. I'm not sure if any of you who have been working there, also in Zaatari refugee camp in Jordan in response to the Syrian crisis there. We were lucky enough to have worked with them in the DRC, and they were working also with War Child at the same time in the DRC. Now APT-ART, they ran a sort of creative communications workshop or painting workshop over that week to explore some of the ideas, some of the some of the barriers to communicating around adolescent sexual reproductive health, some of the barriers around why people weren't accessing healthcare services, and exploring and unpacking those ideas through workshops, activities. So children, the mural was just one of the products that they created from that workshop. Hopefully I can share a web link, or I can do it afterwards, of some of the other work that they've been doing. Look at the work that they've done in Zatari Camp as well. It's great, where they've talked about sort of some of the issues of what it means to be a refugee child in the camp, some of the sort of issues that were highlighted. Also, working with that same clinic, we were making sure that our adolescent and sexual reproductive health program was linking in terms of referral pathways. That's the referral within the community and from other health service providers, to make sure that adolescents knew that that health service was there. And so we were working with local existing community mechanisms to identify what were the best communication channels, how do we respond to some of the issues around barriers. Why weren't people accessing healthcare? What could be done? What could be explored? One of them was around anonymity, and how we make sure that it wasn't obvious what service people were going to, around what room they left the waiting room from, for example. So that was really sort of established through an ongoing dialogue with the youth group that was there, and that was the youth group that was involved in the APTED project. So the painting, the mural itself, is just one of the products that came out of that ongoing conversation. And the conversation was generated from the mural as well, so new people coming along would come and start asking questions, maybe from the peer group itself, you know, why is that message there? The message is in French and in Swahili. Why is that picture there? Why do you have a boy? Why do you have a girl? So that the product isn't the end, it's part of the conversation.
Great, thanks. We have another question on what are possible approaches to monitor and evaluate humanitarian communication plans with communities. If any of the panelists want to come in on that one.
Okay, I can come in on this one. It's Jenny McAvoy here from Interaction. So I think one of our challenges when it comes to monitoring and evaluation is whether or not we can establish a baseline. And whether or not we can establish a baseline, of course, goes back to, you know, the original assessment of the situation people are facing, and, you know, what was our purpose in embarking in a dialogue with the affected population. So I can give one example that perhaps, you know, also goes to the question of two-way information flow. In a program quite a long time ago now in West Timor, there was a refugee population from East Timor that was vulnerable to a forced population movement. They were, within about 30 days, they were going to be moved to another island. You know, this had sort of the endorsement and support of several stakeholders. But in our interaction with them, it was pretty clear that they were uninformed about this forced movement that was about to happen. And if they had known, they wouldn't have chosen it. So in the face of that situation, we conducted a very, very rapid exercise to collect the views and opinions of the affected population. And in exposing the opinions and views of the affected population, we were able, in fact, to mitigate that forced movement. At the same time, this information also allowed us to establish a baseline. So at the time, the government of Indonesia had been basically insistent on sort of moving refugees on from the camp situation that they were in, and looking to find some more permanent situation for them. However, in the absence of a free and informed decision, of course, this is not voluntary. It wouldn't have been durable, and so on. So this baseline of whether or not people felt informed, whether or not they were making decisions freely, whether or not it was voluntary, et cetera, sort of gave us a baseline against which to, number one, design an information campaign, and number two, to track whether or not enhanced access to information was having the desired effect of enabling people to make their own decisions. And indeed, we found that it did. The information campaign could be very much tailored to their information gaps of what are the things that they felt they needed to know in order to make decisions and move on from a camp situation to a more durable situation. It allowed a two-way information flow in that every time they articulated their information needs, it allowed us to go back to the duty bearers, the government officials in particular, to respond to those information needs. These all became things that could be measurably tracked over time. And I guess I wonder whether there are other examples that we might look at in terms of tracking the specifics of information needs and whether or not those are being met, and whether indeed meeting those information needs has a consequential effect on the level of risk that a population is experiencing. In our experience in that example, in the West Timor context, it depended on having a very granular, disaggregated understanding of all of the risk factors, being able to isolate those and track and monitor those.
Okay, we'll do one. I know we're at time at 11 o'clock. We'll go ahead and take one more question before closing it off. And all of you should be aware that this discussion isn't ending here. So the questions that are being put on the webinar right now will carry over onto our online discussion forum over the next 3 weeks. But we'll take one more before closing.
We had two questions that were kind of about similar things. So one question about best practices of communicating with communities and how those are shared, refined, and documented. But also particularly where CWC has been effectively used to measure protection outcomes, and how those two go together.
Hi, this is Nicki from the CDAC network. I can certainly talk to the first one. The CDAC network is increasingly attempting to capture best practices on CWC through different network members, sharing their experiences and learning from the field. So please check out the CDAC network website, and as we continue the discussion over the next 3 weeks, we'll also endeavour to try to bring as many of those examples to light as we can.
Katie, we just lost you. Or sorry, Nicki, we lost you. Oh, you were done. Okay. Okay, so definitely look at the website from CDAC to explore some of those examples. I just wanted to say, given the time that it is 11, a little bit past 11, wanted to go ahead and close the webinar. I want to say thank you to all of the panelists today for sharing your expertise and your experience. This has been a pretty informative and enriching discussion. And as I said, this isn't ending now, so we'd now like to invite all of you to continue engaging with us over the next 3 weeks online through the discussion forum. And you can see on the web now the link to that. And if you haven't already registered, please do so. So the purpose of these discussion forums are allowing us to explore examples, some of the challenges and the methods used to strengthen a results-based approach to protection. Following this discussion, Interaction will evaluate and analyze the conversation to incorporate the learning into results-based protection program and to determine the elements for further exploration. A summary of this discussion and analysis will be shared with all of the participants that engage on the online discussion. So please do sign up if you haven't done so already. And all of the questions we were not able to get to today please bring them back into that discussion forum so all of us can offer thoughts and perspective on how communicating with communities can strengthen protection outcomes. Thank you again, everyone, for participating, and we look forward to your contribution over the next 3 weeks.